Good afternoon, everyone. I'm Dr. Shilpa, and today I present to you an interesting case of contact lens induced severe keratitis. Now, a 26-year-old female presented with whitish discoloration and defective vision in both eyes since 2 weeks. She was a myopic and she was a regular contact lens user. She was already treated before presenting to us with topical antibiotics, fortified vancomycin and ceftazidime for 5-day duration with no response. Now this was the day 1 presentation where she had bilateral 9 into 9 millimeters grayish white infiltrates with rounded smooth margins, anterior to posterior distribution with an intact epithelium and fine granularity. At this stage, the corneal scraping was done, and while the reports were awaited, we looked at differential diagnosis of corneal ring infiltrates, which include neurotropic corneal ulcer, acanthamoeba keratitis. Sometimes it can be pseudomonas or fungal keratitis, peripheral ulcerative keratitis, or subgent keratitis. In our case, our clinical suspicion was first to be acanthamoeba keratitis, especially since it was contact lens related. The treatment was shifted to polyhexamethylene biguanide eye drops, while also adding voriconazole and ceftazidime to cover for fungus and bacteria as the micro reports were awaited. This you can see day 4 picture. Within 3 days, there was a drastic reduction in density and size of the infiltrate. However, microbiology came negative. We also did a confocal scan which came negative for any organism. This made us wonder because such a quick reaction for acanthamoeba keratitis with PHMB eye drops in just 3 days is not possible, and there was an intact epithelium with minimal pain. Hence we thought whether it could be immune keratitis. Weasley rings or corneal immune rings are sterile non-infectious ring-shaped stromal infiltrates that can occur due to a hypersensitivity reaction, most common being foreign bodies, contact lens wear, refractive procedures, etc. And interaction of these foreign antigens with antibodies from limbal vasculature result in immune complexes which activate the complement system. A low density of antigen presenting cells in the central cornea and a 5:1 peripheral to central ratio allows these rings to be more peripheral, and the central cornea gets spared, and these antigen antibody complexes, they deposit peripherally. This is a similar presentation of a Weasley ring in a patient with contact lens history, who developed a immune keratitis. Hence, we changed our treatment regimen based on this with the introduction of topical steroids, that is prednisolone acetate eye drops was introduced initially 4 times a day with a background of reducing ceftazidime, vozole and PHMB. This is the day 7 picture where just 3 days later we saw further reduction in density and size of the infiltrate. Now since we were sure, we completely stopped the antibiotics and shifted to prednisolone 2 hourly along with addition of tablet Vizolone 20 mg, which led to reduction in stromal edema and further clarity of the cornea. And you can see in just 8 weeks, the best corrected visual acuity improved to 6/9 in both eyes. And here we tapered the steroids in order to achieve complete clarity. Hence the case was rested. To conclude any case of severe keratitis, looking at the clinical picture, we suspect infection first. Do your microbiology and the confocal and other diagnostics available to rule out infection. Proper documentation and aggressive management. Reassess the situation, look for the response, and change approach whenever necessary to get the eventual cure. Thank you very much.
Thank you, Dr. Shilpa, for excellent presentation and excellent case. I would like
Thank
to
you,
know one thing. Did we culture the contact lens solution used by the patient or the contact lens itself?
Unfortunately, no, sir, because that was removed by the primary ophthalmologist. So before sending to us, they had discarded the contact lens and the solution. So, but yes, that would be the right way to culture that too.
One thing is there that because it was a bilateral presentation, very smear and then infiltrates also, I would like to ask you that you have to go for the treatment as an infective only.
Yes,
Even if we suspect it, which is,
yes,
and your case
correct,
also in the beginning
correct,
has responded to the
yes,
treatment, which is a
yes,
cocktail treatment, but it has
yes,
responded.
yes.
And to me, basically, bacterial keratitis remains the most frequent
Yes,
one, and that will be taken care of the antibiotic. And in
correct,
any other case, we do
correct.
go for the topical steroid
Yes,
later on.
yes, sir.
what do you plan for the future for this patient? What is your suggestion?
This patient vision is almost near normal now, 6-8 parts in the other eye. So once we stop gradually taper the steroids, we just continue the topical lubricants, and then now she is afraid and not keen to go back
Yeah.
for contact lenses.
That's what I wanted
just
to-
glasses for now.
Okay.
Thank you
so much.
Thank you.